want to reliably measure the number of people with mental illnesses in your county jail, use that to accurately quantify the problem, and then implement best practices proven to produce results. And lastly, you want to track progress over time and adjust efforts as needed. Okay, so now I'm going to throw it over to Dr. Taxman to talk to you a little bit about how you might go about getting the data to drive this type of project.
Well, hi everyone. This is Faye. I'm Faye Taxman. I'm with the George Mason University. I'm a professor at George Mason, and I also run a research center with a devoted mission to improving outcomes for people who are justice involved. And we do that through many different ways, mainly through identifying effective interventions, identifying effective systems and processes, and developing new ways of conducting research in justice-related settings. So I'm pleased today to provide a very quick overview of a very difficult and complicated topic, which is data and evaluations. So essentially, there are three types of evaluations. There are process evaluations, there are implementation studies, and this is an emerging area of science, and then there are outcome or impact studies. In a process evaluation, you want to know what's being implemented and how does it compare to what you had planned to do. Process evaluations are very good to explore how things are going early on and to also identify what are some of the system issues that need to attend to really help a program or initiative function well. Implementation science, as I said, is an emerging area, and that area is really about addressing the barriers and facilitators to change in your system. Through CSG, we've been doing a number of broadcasts on implementation science, so I would encourage you to actually contact CSG, your program officer, or Marilyn, and ask to get access to those webinars. We also have a lot of documentation that we've provided through some work that we've done with the Bureau of Justice Assistance. And then the third area are outcome and impact studies, and those actually have to do with what impact does a particular intervention or practice have on outcomes, looking at various outcomes like functionality, behavioral outcomes, recidivism. But what's important to here is to basically have some sort of comparison or control group in order to do that. So in today's talk, we're primarily going to focus our attention on process issues and implementation issues as a way of beginning to think about how do we get those types of measures. You know, everybody usually wants to go to an outcome study to find out whether or not what they did worked, but usually you need the information about what was implemented, how what you're implemented has an impact, and therefore, I highly recommend that a lot of the systems really begin to focus attention much more on process and implementation studies. Okay, so as I said before, a good study always has comparison groups or control groups. A good study also has more than one time period that they're collecting data. Now, I'm not going to give you a crash course on research methods. Many of you probably have already been exposed to that. I know that my colleague, Al Kopak, who is a wizard at many of these different types of design. But I do want to say that it's really important to have comparisons. And comparisons allow you to see whether or not what you're doing is different than what would normally be expected. So we're not going to talk about randomized controlled trials where the researcher randomly assigns people to different categories, or quasi-experimental designs which come up with a comparison group that is similar to or like the individual, the folks that are being exposed to your Stepping Up initiative or any program initiative. And there's different ways of coming up with that like group, wait list, propensity score matching, individual match, or group matched activities. So those are all really important when you want to look at impact. But when you want to look more at process as well as implementation, and I'd also say impact studies, having multiple observations is really important. So you want to have observations pre and you want to have observation post. So one thing that's one of the recommendations for the Stepping Up sites is for the sites to actually have an estimate of the number and proportion of people who are in jail with mental illness or serious mental illness. That's when you start your work as a team, so you know where you are. And then you can observe over time by continually collecting that information or observing that information to see what changes that you're making in your system that may have had an impact on that, likelihood that an individual with mental illness would be in jail. So that's my crash course on research designs. Obviously, there are textbooks. I am happy to give anyone some references on this particular topic. But the more important question, that's what today's conversation is about, is data. What type of data do we need to understand how our systems work and what changes actually have occurred? So data includes, as I said before, it can include a baseline measure or it can include a change measure. So baseline measure is basically data that tells you at the beginning what your picture looked like for your system. And it basically tells you whether or not where you are and allows you therefore to look at change. So here in baseline, like I said before, getting a baseline of the number and proportion of people with mental illness in your jail is, one important baseline measure. Another baseline measure that oftentimes is how many people are screened for mental illness in your jail. Those are examples. Change measures have to do with looking at the difference in your baseline measures over time. And there's various different types. There's pre-post measures where you have one observation post, the implementation of Stepping Up or some other innovation that you're doing. There's a change score that basically calculates the difference between your pre-measure and your post-measure. And then there are behavior measures that look at how do clients function over time. It's important to keep in mind what your measures are and what you're trying to measure. So as we know in Stepping Up, we're trying to have 4 different measures of what happens to people with prevalence of mental illness. So one measure is how many people get booked or how many people are diverted. So that's a good, way of looking at your system. A second measure is how long do people with mental illness stay in your jails. Many will tell us that that's a very difficult measure to get, but it's important because it lets you know whether or not the system changes that you're putting in place, like screening or assessment, have any impact at all on the client's length of stay. A third measure is how many people are in treatment in the community. Again, here we're interested in whether or not Stepping Up increases that connectivity to the community treatment providers or has an impact on increasing the amount of capacity in the system. And then fourth, we're looking at recidivism as an outcome measure or behavioral functioning as an outcome measure to tell us whether or not the services that are provided had an impact on the person overall. So these are our 4 driving measures. And as I said, the best thing to do is to get a baseline measure for each of these 4 measures before or during the early phases of your Stepping Up project, and then move into collecting similar data over time. I also wanted to point out that, a good source of information about what you're likely to expect comes from research articles. Now, I know a lot of people don't like to read academic articles. They're convoluted, they're not very clear. Sometimes it's like you're scratching your head going, why do these people spend so much time talking about their methods? Or why do they spend so much time talking about, the background of why we're doing what we're doing here? And that's because there's a format to a research article, and it's always good for you to be able to understand that where you want to pay attention is in the methods section to figure out what people did, and the findings section to figure out what the results are. Not to say you shouldn't read the whole article, because of course you should, but if you want to know where to get the home run from, those are the two sections that can really help us. All right, so let's begin to talk about different data sources here. One data source that a lot of people use is spreadsheets, Excel spreadsheets or some other type of spreadsheet, and administrative data. Now, I'm a big fan of administrative data because that data is really something that's underutilized in our, in our analysis. You can use administrative data to basically allow you to look at what some of the baseline measures are, but also what are some of the considerations. So years back, I won't tell you how many years back, I worked with our local jail, and we basically came up with a report that looked at the length of time in jail for different types of clients, by gender, by age, the client, by offense, by legal status. And that was very informative, and it was a different way that people had used their administrative data. But they, to this day, the report still exists. They even call it the Faye report, which I find really funny because it's been many, many, many moons. But that report basically lets them see how many people are spending time in jail and for how long on average, so that they can begin to target their different initiatives. And that's one of the things with Stepping Up that could be really important, is trying to figure out how we can reduce that length of time in jail. So we're releasing people earlier, but we're also getting people to participate in services that are more adaptable for them. So don't overlook your administrative data, and think about what you would want to track in a spreadsheet. Another series of data, and this is what I was calling the multiple observations. It's also referred to as time series measures. And this is allowing us to check at different points in time to basically see how things are progressing. So in that report that I developed for this one local jail, they're able to actually look at what the average length of stay is for different types of folks. And therefore, they can look at whether or not they're nudging reducing the length of stay based upon different efforts, like when they introduce new screening efforts, when they have new procedures for helping people get pretrial release, when they've been able to develop diversion programs, so clients who are booked in the jail and have a mental illness, they're able to go into some sort of community treatment program. But you can look at these measures over time and see actually what's happening here. Another source of data are surveys and interviews with either staff or clients or some of your external stakeholders. So I think what's important here is that administrative data tells us about the clients, but it only tells us factual information, dates, and activities that occurred either in the treatment system or in jail. What we don't get is the perspectives and opinions of people, and this is where surveys and interviews are very, very helpful. It allows us to ask a series of questions. We can look at whether or not there's agreement amongst staff on a particular idea or concept. We can also look at how clients function and what clients' perspectives are. We have learned in the research that if you really want to understand the barriers to people getting into treatment, one of the best sources is to ask clients. They'll tell you about all the different paths they have to walk through. I would also recommend, if you're doing surveys, that you try to use standardized measures or scales. And these are prevalent in the psychology field, and in criminal justice, we have some of our own measures, like risk and needs assessment tools, but there's also measures of people's perception. So there's measures of patient satisfaction scales, there's measures of opinions of counselors and the experiences that people were exposed to. So these are all really important. Okay, another source is interviewing. So there are different types of interview methods. I'm not an ethnographer or qualitative researcher, but I work with a lot of really highly talented researchers, and they will tell you that some of the best information about staff, about clients, about systems really comes from observing and talking with people, oftentimes in a very unstructured manner. We're just having conversations, and people are able to talk about their experiences as they work through different things within their system. Like any good method, you need to have a method for taping and coding the individual, and then you need to have a way of dealing with themes and identifying the themes that can come out of the data. There is a theory of grounded themes, and that basically is that you shouldn't go in with preconceived notion. You should really let the data drive for you what it is you want to, what's likely to occur. And so by basically using grounded theory, you can identify themes that evolve from the interviews or the observations, and that's usually a very rich source. Now, one of my more favorite techniques is actually a combination of many of the techniques I've just talked about, but something called direct systematic observation. So the whole focus of a systematic observation is to really, over a period of time, observe, interview, collect data, so that you can see patterns emerge, you can see the stickiness of certain sort of issues, you can see how people navigate through the system. In any case, you're able to really detect areas in which things work well or things don't work well. You can plan these observations of different people at different times. So if you're working in jail, you want to make sure that you get the night shift, you get the morning shift, afternoon shift, that you have experience with all different types of systems in the jail, whether it be booking or whether it be in intake officers or whether it actually be on units. But systematic observations are a really well-designed methodology for collecting data and basically giving us a way of synthesizing across people, places, and things so we get a sense of the richness there. Okay. Now, another big piece is what you do with the data. And because Stepping Up is an initiative designed to change systems, the question you want to ask yourself is, how is my system doing? And then try and use this data to get a picture of the influence of the system, the points in the treatment process, observe areas where things are working well and areas where things are not working well. So brainstorming from your data is a really important skill. It's actually part of the quality improvement processes, also a topic that we've had discussions on CSG webinars, and I encourage you to explore the quality improvement, webinars that we've done to get a sense of the process by which you can do this brainstorming and have it lead you to different types of, outcomes. Okay, so once you get this data, what do you want to do? Well, I'm presenting here the Cascade. So I'm hoping that we help people, particularly within Stepping Up, begin to think about their initiatives as an initiative of looking at how people flow through the system. This actually is an example from a juvenile justice system. And as you can see here, the goal is to look at intake, screening, assessment, and identification of clients in need, all within the justice system. Look at the referral process, and then look at who comes out of these processes that initiate treatment and care, and those who stick with the treatment and who continue into some sort of continuing care. The Cascade is a very visual process. It helps us really see the system overall, and it helps us look at how things proceed. So you can see here with the missed opportunities, identified needs, that, essentially what the Cascade is doing, it actually helps us do a visualization. Okay, so what are some of the processes you want to look at when you're doing a Cascade? You want to look at the screening process and what comes out of the valid tool. You want to look at assessment and how clinical confirmation of a need is made. You want to look at who is denoted as being in need, having a mental health issue, serious mental health issue. And then you want to look at what types of referrals are made for clients who are positive. If a referral is made, who initiates care and how long can they get into treatment? Then you want to look at how people are engaged in treatment, and then continued levels of care. So all of this is designed to really focus your attention on understanding how your system works, and these feed into this Cascade model here that I've presented. I want to talk a little bit about referral. So this is often a sticky point. If we want to reduce the length of time in jail and we want to increase community building, then we're really going to have to look at how we make appropriate referrals. Now, in the addiction field, the ASAM criteria level of care is a good example of trying to actually match client needs with actual services that are provided. In the criminal justice system, we don't necessarily have ASAM, but we do know that based on the risk needs principles that we need to target certain behaviors and make sure that people get into programming based on those behaviors. So when we look at referrals, you want to look deeper in terms of what is the criteria of need for mental health services, what can you do to reduce the symptoms that the clients have, and then since we know that duration of care is an important component to better outcomes, how can we put people in services that will emphasize the longer periods of time? So collectively, I've kind of run through very quickly in the last 20 minutes or so many different sources of data. So I want to sum up here that a good activity is to really think about how to link data across different sources. We have multiple sources of data, where it be administrative data, EHR data, EMS data, treatment data, jail intake data. And the question is, we need to have ways of linking those systems, and there's some great new strategies that people are using, topic for another time. But I would really suggest that you inventory your system to see what your different data sources are and then what you could actually do with that data. Okay, so that's my crash course in data. I think I'm going to turn this over to Dr. Johnson and Dr. Caprice. Thank you all for the time today.
Thank you, Faye Taxman. So here in Alachua County, we have, I assume we have run into the same walls everybody else when we're going out there asking for quantitative data. Some of the issues that we found were not everybody's collecting the same thing. They're not collecting it the same way. There is virtually no reliability across systems. Everybody is collecting what they need based on whether it be their grant, their leadership. So while we need that and we are evaluating each one of them separately, we're kind of hitting a little bit of everything that Dr. Taxman spoke about. But the one thing that we were asked to speak about was the qualitative data. So our intent was to follow the offenders, the arrestees, those that were at risk for entering criminal justice from start to finish and find out all the questions that we were supposed to be answering. We found that there was no real way to do that. So we started changing the way we did it. So we're looking very longitudinal at jail data. We're looking at aggregate of, let's say, provider data or law enforcement data. But honestly, the richest data we've gotten is qualitatively. We've interviewed 30-plus persons throughout the county, and that's judges, state's attorneys, public defenders, jail staff, jail medical, providers, supervision, specialty courts, etc. And we're reaching out on our next wave of interviews to policymakers, commissioners, sheriff, chief of police, presidents of providers, hospital administration, etc. And the things that we're finding are almost to a person the same things. So we're looking for that communication, that collaboration, honestly, if I had to take it down to two things, it would be communication and collaboration. So whether somebody gets out of jail, goes into supervision, is going to some sort of provider for whatever their substance abuse, mental health, co-occurring issues are, the question is, how do we track that person? And Meridian is our primary provider here, and they don't track whether or not they're criminally justice involved unless, and there's always that dot after that. The jail doesn't necessarily, they may Baker Act somebody, and then there's the communication between criminal justice and providers. All of that gets really, really sticky. So that's the one thing that we hear the most. Some of the benefits of what we're doing that I feel are the benefits are we're getting more personal and nuanced data. So the state's attorney wants this, the public defender wants that, the provider wants this, and the jail wants that, the law enforcement. But we're hearing from the experts in their own field. There's no way that the quantitative data can tell you the entire story. And therefore, we're going to the experts in the field. We're getting their points of views. I've been very surprised by how forthcoming our persons have been trying to assist us. Because one thing I can say about Alachua County that we may not be able to say about everywhere else, I don't know. I was a little surprised, let me say it that way. Everybody seems to know what the problem is and be on the page. They want this to change. Our chief of police even said we can't arrest ourselves out of crime. We can't legislate ourselves out of, we can't do it that way. We have to do it more on the ground floor. So one of the biggest benefits, I always think about side benefits. Yes, we're going to go in and have an interview with a judge. But that judge now also feels more included. Their voice is heard. So when we do turn around and want to start recommending policies, that person was involved on the ground floor. And their voice was heard, their opinions were respected. And for us, the qualitative data actually starts very early. So generally speaking, I tend to do the informal process analysis, and I do my best to make them very at ease, very understanding that we're all on the same page, we're all here for the same mission, and they tend to open up. They want somebody to listen to them. In my opinion, that is going to be one of the greatest focuses for us, is having everybody involved. Then we end up going, Dr. Peace, we ended up getting an institutional review board approval, so we have a standardized, semi-standardized interview process. So Dr. Peace performs the formal evaluation. So we take all that information and we evaluate them against each other. What are the trends? What are the diversions? What are the discrepancies? And of course, we have follow-up to go with that. Reason why we're doing it in a two-stage manner is, so the best example I have right now is first appearance. We all went to first appearance very early on in our first year, first couple of months actually of this program. And now when we go back, we're going to see it with fresh eyes, with new information. We're going to recognize things a little bit differently. It's the best way I know how to flesh out the entire process from start to finish. Over the time, we've created the relationships, and people have become very comfortable speaking to us. So when we get to the formal interview process, it's like the playbook is opened up to us. And from that, we're finding we have support for various different suggestions at the end. We are going to wrap up in September for Alachua County, and we'll have the strategic plan ready in June, July, somewhere this summer. So, and we're also speaking to those people we're presenting to. Now, we have had some leadership changes, so that throws a little wrinkle in as far as where the new leadership's focus is. And I was actually happy hearing Dr. Taxman that we basically are hitting every mark of the qualitative side. Dr. Peace, do you have anything to share? Looking at a couple notes here while I...
Yeah, the only, what you just said, I'll take it from there. We're definitely hitting all those marks. Our mixed methods include the semi-structured interviews. What we did and what went through the IRB was a fairly comprehensive, not fairly comprehensive, it was exhaustive list of questions we could ask people, but we didn't ask, obviously, everybody the same question. So semi-structured interviews, and we purposely started from law enforcement, the mental health team, then we went into the jails, then we did the treatment providers, and we went in that order. And while we were doing that, we did the observations, going to first appearance, going to the specialty courts, etc. In terms of the quantitative data, we've got a bunch of, we got about 118,000 cases. So we've got a lot of quantitative data. The problem is everybody, like David was saying, everybody's collecting it differently. So converting it into SBS so we can analyze it is our biggest problem right now. But in terms of doing the process part, we started that, probably a year ago, got it through the IRB, and then basically we have, I think we could say we've finished that. We're probably going to do some more interviews next year, but right now we're turning to the quantitative part to basically compare what people are saying with what is happening in terms of the data that we have from the jail. So we've come a long way, but we've got a long way to go with the quantitative part. We're going to do exactly what you were referring to earlier. We're taking a grounded theory approach. We went in, we basically looked at, we went in, tabula rasa and basically just listened. And it didn't take long for themes to start to emerge, which is exactly what we're going to report, is these themes that come about from the ground up. So we've, in terms of the process part, the qualitative part, we've made significant headway. In terms of the quantitative part, it's a challenge, needless to say. So we're pretty happy with where we're at. If we can get that data, the data converted to into SPSS and start analyzing it, we're going to be able to definitely look at trends over time. I think for the last close to 10 years worth of data.
That's great. Yes. Thank you. Oh, go ahead.
Real happy with it.
Great. Yeah, sorry, David, were you about to say something?
No, I think between us, we got all the pieces out we were looking to get.
Yeah, well, it's great to hear, and I really continue to be impressed with Alachua County, your mixed methods. I think it is going to make for a really interesting study and some interesting results.
Thank you.
Yeah, so I did have one question for the Alachua County crew. I'm curious if you could talk a little bit about how you hope to use your results to inform like future policy and practice decisions.
Yeah, we're hoping the collaboration between the University of Florida and our criminology department and Alachua County continues into the future, because we really would like to look at this longitudinally. After analyzing these data, we want to continue kind of following the recommendations that are made. As the evaluator, I'm not going to make the recommendations. I'm going to turn the data over to David, and then David will present the recommendations. But we're hopeful that one way or the other we can follow this forward in terms of changes that are made. But David will be presenting the changes to the committee.
And on that front, one of the side missions I'm constantly working on is recruiting new persons that we need to have. We initially started off with people from the major hospitals, from major providers, not being present at the table. So the qualitative side, while yes, the number one point is to get some great data, to get the experts in the field to tell us what they think is best, because we can look at the data and the quantitative data and say, hey, this per SPSS looks like a good trend or a good idea, but if you don't take it to the people doing it and get their input, I don't believe, honestly, that would be sustainable. So having their buy-in and then having them being a part of the team, we want this relationship to go forward. We want to create lines of communication. We want to create that true collaborative effort. And if we get some data and some good information out of it in the meantime, great. I almost look at more personally as that personal connection, that face-to-face connection, so we can move much forward. We want to get more relationships with the major hospitals, with the University of Florida, so we can start to tear down silos and really come together and have all the greatest minds in one room figuring out how to address the issue at hand.
Great. So just a reminder to everybody to please enter any questions or comments into the little comments box, little chat box down in the bottom right-hand corner. Faye, it looks like we have a question for you. It says, please provide suggestions of good standardized satisfaction survey for incarcerated individuals with substance abuse and mental illness histories.
So you're looking for, the person is looking for a satisfaction survey. So are you looking for a satisfaction survey in terms of people's experience in their facilities or their experience with treatment programs? Because those have different types of satisfaction. Like, for example, in people who are incarcerated, oftentimes you want to know how safe they felt and whether or not they felt that they were, being treated with respect within those facilities. Whereas in the community, when you're looking at satisfaction issues, you're actually, that can also range from someone's experience with the treatment program to how well they feel that they had a voice in the process. So those are all different dimensions, and I need to know a little bit more about what people, someone said, okay, great, experience within the facilities. So I would recommend, if you are trying to look at people's experience within the facilities, the name of the author is escaping me right now, but I can send that to Maryland, and she could send it out to you, Nina. I just can't remember the author of a couple instruments. And I don't know, maybe others on the line might know of some. Yeah, so if, if you want to email me, I'm happy to send a copy of the instrument once I figure out which one.
Yeah, so I just put the slide up here with all of our contact information. So, Nina, feel free to reach out to any of us, or I guess myself or Dr. Taxman can get that to you. Any other questions or comments? I have a question for you, Dr. Taxman. So let's say there's someone on this call who is really just getting started out with this project, and maybe they don't have a research partner or, a contracted university partner on their project. How would you suggest someone get started with trying to look at, like, the 4 key measures?
Well, if they're looking for someone who has experience in this particular area, I would actually, there's a couple things I could do. They could feel free to contact me, and I'm happy to kind of link people up to researchers in various places, because it would be good to have someone who's local and you can develop that relationship over time. So I'm happy to do that. Another avenue that you could look at is actually contact the Division of Corrections and Sentencing of the American Society of Criminology, and they can put out a listserv and with that person's name, and that usually goes out to about 500 people, of which I'm sure one of them would be in close proximity and might be interested in working with your particular team.
Great, thank you. Okay, so just a reminder to enter any, we just have a couple of minutes left, so to enter any last minute questions or comments into the box. And while we are doing that, just a couple of quick notes on items that we have coming down the pipe. So we have the next 2 learning community calls are scheduled for December 4th. The next one is December 4th, and we're going to talk about high utilizers. And that one is from 3 to 4. And then the one after that is December, sorry, let me check my calendar, make sure I'm telling you the right date. December 11th from 2 to 3. And for that one, we're going to talk about, we're still kind of hammering out exactly what that will look like, but we're going to talk about like linking data and sharing data and things like that. And we'll figure out kind of a little more what that will look like, and we'll let you know. Okay, well, here we go. Could you send the invite out to those of us on the call? Yes, so whoever your technical assistance provider is should be able to share those with you. So you should, whoever your assigned CSG technical assistance provider will have access to that and can send that along. Or another option would be just to email me. You have my contact information here, Marilyn Leak, and I could send that to you as well. Okay, so seeing nothing, any last-minute comments or questions from Dr. Taxman or from the Alachua County team?
So this is Faye. So I want to encourage people to do what the, Dr. Johnson's group is doing, which is talking to people. I think, we underestimate how much clients and staff can help us figure out ways around sticky problems, and, good interviews are very useful. So I just want to encourage that method.
Yeah, thanks.
And I just want to reinforce what you just said. That is absolutely true. I mean, we were pleasantly surprised with the candor that people responded to our questions. So absolutely, it's a great place to start in terms of the question that was asked. If you don't have a research background, where do you start? The book, The Criminalization of Mental Illness, will cover everything we're talking about, as well as just having someone help you put a semi-structured interview together is extremely helpful, because it segues right into what data you might want to look at.
Perfect. Thanks, Dr. Capiz.
Sure.
Okay, everyone. Well, you have our contact information here. If you have if anything comes to mind, if you have any questions, please feel free to reach out. And otherwise, we'll just look forward to hopefully speaking with everyone in a couple of weeks on December 4th during our next call. Thanks,
Thank
everybody.
you, everyone.
Have a good day.